Malaria, tuberculosis, cholera, HIV, AIDS, name the disease, you have it here. Here in the heart of the other India, here in the country's poorest state, Chhattisgarh. These are bleak faces around me, faces with hardly any dreams worth dreaming about. But there is one glimmer of hope. 7 years ago, 8 doctors, almost all of them from AIIMS, decided to give everything up and come here, looking not for glamour, not for money, but for chance to serve the people who need to be served. The 4 couples are spreading sunshine here in the jungles, not far from where Naxalites challenge the rule of the law. And though it's just the dawn of a new day, and the shadows still linger on these faces in the queue, rural Bilaspur gratefully acknowledges the presence of these doctors who are slowly changing their lives.
बिल्कुल भरोसा है साहब, इतना यहाँ अच्छे तरीके से माने इलाज किया जाता है कि हम खुश हैं।
It happened more than 10 years ago. Some doctors in AIIMS, the best medical institution in the country, wanted to do something more with their lives. They wanted to step out from a big city, move to the countryside, serve the rural poor.
रोटी खाना है, सब कुछ खा सकते हैं.
Idealism was more important than getting rich. It took a long time to set this hospital up in Ganiyari, 20 kilometers from Bilaspur town, and 7 years later, the results are really showing.
जो ये हॉस्पिटल है, हम तो उसको मंदिर मानते हैं.
Meet Dr. Yogesh Jain, the inspiration of the team. Dr. Anurag Bhargav, the Mr. Energy of the group. Dr. Raman Kataria, the quiet surgeon. And Dr. Biswarup Chatterjee, the polite microbiologist. They had an intellectual support system in Delhi, doctors, scientists and the rare bureaucrats who believed in their dreams and helped them pursue it. Some of these doctors went to big school, DPS R.K. Puram and modern school Barakhamba. 3 of them are national scholars, and all 4 just came together.
I think Yogesh asked me, I remember the exact place, even I think it was in 94. He asked me if I'd like to do this kind of work, and I just told him yes without even consulting my wife.
What acted as an even greater catalyst was that all 4 married doctors, Dr. Madhvi Bhargav, Dr. Madhuri Chatterjee, Dr. Rachna Jain and Dr. Anju Kataria. Some of them even met in AIIMS.
We were working in the same hospital, All India Institute of Medical Sciences. But all of us were together, there were 8 of us, and that made things easier.
Every couple takes home a total salary of rupees 25,000. They don't want more because then it causes too much disparity with other members of the staff. Is that enough family income in the 21st century?
I don't think I miss driving around in a Mercedes.
I mean, if it's more, then we just wouldn't be able to run the organization. I mean, we are taking 12, which is a big chunk. I mean, most of our other staff members take much less.
In Ganiyari, you get the feeling that it's the women who are sometimes doing more than their husbands. They do surgeries, they man the OPDs, they run the 13-bed ward, and they even attend clinics in the remote villages. These women are more than equal participants, and they have their views on the money their husbands and they themselves take home.
There are financial constraints. I won't say that they are not there. Sometimes one regrets also, but it's okay. But one feels more satisfied after doing. At the end of the day, you are happy.
I think one needs more if you increase your own needs, and you never know where you can get satisfaction.
So they keep their food simple. Take a look at this canteen, where doctors, patients, friends, other members of the staff all come together. And it's about self-service. Self-sufficiency and personal hygiene are both basic requirements here. So after an ordinary but nutritious lunch, what you need to do is wash your own plate. And they have their children, whom they don't want to deprive, and they are sent to Jain International, the best school in the outskirts of Bilaspur. There are the birthday parties, like this one for Biswarup's daughter, where they come together and talk everything but work. Some do have support system, like Dr. Rachna Jain's mother, who is also a doctor. She has taken up a job at the Bilaspur hospital and lives in the neighborhood to stay close to her granddaughters. She is quite honest that her son-in-law doesn't earn enough.
Well, it's not my decision. It's their decision. And before marriage, if I knew so much, I would have taken a decision. Otherwise, now it's their decision.
Dr. Biswaroop and Madhuri Chatterjee have other worries. Their son has a medical problem for which they need money. The treatment is seriously expensive. He has to take up temporary jobs elsewhere to keep the money coming in.
Well, I don't think I'm switching between jobs, but yes, I definitely need more money for my son. Although all my friends have been very supportive. But even then, as a father, I feel obliged that okay, whatever I can earn myself, it's better. Done that way.
8 people who are together living out a dream they had dreamt ages ago. What about ego conflicts? There are bound to be differences.
There are moments of ego conflicts. It's always there are problems, but the main goal is the same, and the motive of coming together is we bear that in mind, and we are continuing.
And so every Monday, Wednesday and Friday mornings, Ganiyari hums with activity. The queues are long. Swasthya Sahyog has taken over healthcare in Bilaspur. The primary healthcare centre is desolate. Even the doctors and other staff are seldom present. 8 doctors have turned things upside down in this tribal and scheduled caste dominated very backward district.
I don't think anybody can do so much as they are doing. You would rather describe them mad? In normal parlance, I being a normal human being, I will call them mad.
These doctors are definitely not the firsts of their kind. Others like this equally popular bearded doctor travelled this path before. Dr. Binayak Sen had given up everything after graduating from Christian Medical College, Vellore, and had dedicated the early part of his medical career to the health of miners. He has been an inspiration for these doctors as well.
Yes, in many ways, because there is a group of doctors in Bilaspur, as you know, who wanted to, they were also socially motivated and they wanted to work together as a group.
Fortunately, Ganiyari and Bilaspur are slightly cut off from the spreading Naxalite map of the country. These doctors can avoid tough decisions, which Dr. Sen couldn't.
A remarkable change has been made possible in the past 7 years. A big community of trained women is keeping a close watch on the health of their neighbors. Ambulances are bringing in emergency cases to the Ganiyari hospital, where doctors receive and treat patients with unquestionable dedication. But beneath these positives is a set of questions which the doctors have begun asking. Why is the social system so unjust, so unequal? When we come back, we'll try to understand how these doctors want the imbalances in the public healthcare system to be corrected. When you work in such conditions of abject poverty, your ideological moorings are bound to be different. You're obviously going to be extremely critical of the role of the government or the private sector in the healthcare system. These doctors are daily dealing with the problems of malnutrition and are left wondering if the food insecurity problem will ever be solved. So they have now begun questioning if the rising Sensex of the fancy economic growth rate makes any sense to those who are looking to a healthy village road or have never experienced electricity in their lives.
130, 140 हमारे पास छोटे बड़े प्लांट मिला के सेल को लें, जिंदल को लें, भूषण को, बाकी लोग जो आ रहे हैं पुराने जो काम कर रहे हैं, स्टील में तो बहुत बड़ा एरिया है जो काम कर रहा है. टाटा भी इच्छुक है आने का, एसआर भी इच्छुक है आने का.
But the state cannot hide its abysmally poor development data. It has a high infant mortality rate of 78 per 1,000 live births. The rural infant mortality rate is even higher at 95 per 1,000. And the healthcare system is in a shambles. The state has just 6 district hospitals and merely 512 primary healthcare centres. South of Bilaspur, districts like Dantewara and Bastar have been taken over by the armed revolutionaries. In fact, the figures suggest that in the absence of these doctors, the lacunae in the system would have been even more glaring.
In fact, we find medical poverty as a major issue. People getting poor due to the fact that they have to seek health care at exorbitant rates. And this has also led to this, that there are a large number of people who do not seek health care anywhere because this cannot afford to do.
Therefore, it's only to be expected that the doctors will harbour strong views on claims being made that liberalization has achieved miracles.
Probably the urban middle class has benefited, but the rural, we have reasons to feel that the nutrition levels and the financial situation of most of the rural Indian people has probably gone down in the last 10 years or so.
So given this grim scenario, the doctors are chipping in with whatever they can, like making drugs available at affordable rates. Cheaper medicine sold from the pharmacy bring people from far-flung areas to Ganiyari. And it is because he now has easier access to insulin shots that Sufal has managed to survive. He's an acute diabetic and his helpless parents relied on fate alone before Sufal decided that a 30-kilometer weekly journey to Ganiyari is the best option. And these three young people have heart problems. Their valves are defective. Their condition explodes the myth that cardiovascular problems or blood sugar are always urban problems.
Rheumatic heart disease is a life-threatening disease, cardiac disease, which affects mainly the young in India, mainly the poor, and because of the way our population is distributed, mainly people in rural areas.
This 13-bed ward is a fair indication of the kind of diseases they have to deal with in the countryside of the new millennium. This is a full-blown AIDS case. He's a migrant worker who has returned from a big city with the disease and may have passed on the virus to his wife. And close by, this 15-year-old mother is nursing her infant. The doctors say the policy planners don't understand that there is nothing called a rural or an urban ailment.
It's not that the problems in rural areas are different from those in big cities. The same kind of problems are there. Plus, malnutrition related problems are much.
The conditions are depressing, but doctors have not given up hope. There are moments like this with a bonfire in the evening when the doctors and their staff come together to celebrate. Every day is a grim day. Every day is a fight to save lives. So they must celebrate their bonding, celebrate their staying together, celebrate that there are others who are being inspired and joining their ranks.
This fire is not just about fun, though moments like this help lighten up a long journey in which many others have joined in. This fire is also symbolic of the will to carry on.
In fact, the doctors have turned creative. With help of colleagues from Delhi, they are designing the poor man's medical equipment. This electrophoresis apparatus, which separates sickle cells, has been developed in Chattisgarh in the back of the beyond. It has been developed because the branded separator available in the market is too expensive.
The entire thing we have sold to many non-profit organizations for 3,500 rupees. Keeping a market price electrophoresis equipment you don't get in the market for less than 35,000 rupees. With an aluminum cap with a
Not just this. This water testing kit, another of JS's innovations, costs 5 times less than the market price. This is a double stethoscope, which is put to wonderful use while training semi-literate health workers. Of course, what really stands out is the community health scheme. Meet Kumara Devi. She has been taught to read and write. And here in a remote village on the edges of the forest in Chattisgarh, she knows how to make a blood smear, wrap it hygienically, and send it to Ganiyari through a relay system. A local boy carries it to the bus stop. The bus driver takes it to a dhaba close to the hospital. And there is a hospital hand who picks up the sample. The report is sent back the same way.
If we were to decide on a minimum level of literacy as a selection criteria, we would have almost eliminated the chances for a poor woman who would otherwise be socially most appropriate to look after healthcare needs of